Welcome to today's webinar hosted by EnlivenHealth. Today's webinar title is Decoding Medicare's PrEP Coverage, a Guide to Billing and Reimbursement. Thank you for joining us today. Before we get started, I'd like to highlight a few housekeeping items. Please type your questions in the Q&A tab to ask questions throughout the presentation. We'll be sure to answer your questions during the dedicated time at the end. We are recording today's webinar, and the recording will be emailed to all those who registered. And now I'm delighted to introduce today's presenters. Carter Tatum is the Solutions Sales and Strategy Manager for Financial Solutions at EnlivenHealth, where he leads his team to help community pharmacies get as much value as possible from our financial solutions. Carter's been working for over 4 years to drive growth and success for independent pharmacies and has worked with over 1,000 community pharmacies to help them understand the power of their data and analytics in order to help them grow their business. Angel Cahaley is one of EnlivenHealth's medical billing experts and trainers. Prior to joining EnlivenHealth in 2021, Angel worked at a retail pharmacy as a pharmacy technician for 6 years and a biller for 3 years. And now I'll welcome Angel and Carter to the stage.
Wonderful. Hey, thank you so much, Nikki. And thank you everybody for joining us today. We appreciate you carving out some time and spending that with us here. We're very excited to have you all here today. And the reason we were so excited, and one of the things that we want to start off with, was the agenda, and because the topics we're going to be covering today is something we've been getting a lot of inquiries about. And so we are very amped up, Angel and myself, to go through today's agenda. Before we kick off, I want to quickly go through some of these talking points. We're going to start off with an introduction to EnlivenHealth's mission and vision, first off. Then we'll dive into understanding the recent changes to Medicare's PrEP coverage, what services are covered and what those changes mean for patients and providers. After that, we will provide some practical guidance, including some medical billing best practices for PrEP. Then we will explore navigation of the 340B billing and reimbursements. And following that, we're going to spend a moment to review MedBill, which is EnlivenHealth's medical billing solution, and how it can help support your pharmacy with either 340B and the PrEP conversations we're going to be having today, or even some scopes outside of that. And then wrapping up, we're going to end with a live Q&A session, spending roughly 10 to 15 minutes answering any outstanding questions that we receive throughout today's webinar. If you have any questions at any point today, I want to encourage everyone to not hesitate and drop them into the Q&A section here in Goldcast. I'll be keeping an eye on them myself. I know Angel will also be keeping an eye as well on those questions throughout the webinar. So if you can't use that or have any questions, let us know. There's a chat feature as well. But again, we highly encourage anyone that has any questions to utilize that feature. And if we can't get to the question throughout the webinar, we'll save it for the end for the live Q&A. And rest assured, if we don't get to it during the live Q&A portion, we'll reach out to you and make sure that question is answered and that you are taken care of after the webinar has completed. With our agenda now in place, let's jump right into our first topic. EnlivenHealth's mission and vision. So EnlivenHealth's mission is to be the innovative epicenter where health and care unite at the pharmacy. Here at EnlivenHealth, we are dedicated to transforming pharmacies by providing them with the digital capabilities to optimize population health, deliver exceptional patient care, and cultivate sustainable growth. We advocate for a world where pharmacy teams stand at the forefront of healthcare, empowering them to practice to the top of their license and aiding them with their commitment to patient care, collaboration, and continuous learning. Without further ado, I'm going to hand it over to Angel to get us started with our second topic today.
Hi guys, so today we're going to learn a little bit about PrEP, the changes that Medicare has recently made and what that means for your pharmacy and your patients. Oh, I think Carter and I are both changing slides. All right, so what does Part B cover? So what are the changes that's happened since September? So as of September 30th, 2024, Medicare covers the following service without cost share. So what does that mean? This means no copays, no deductibles, no patient responsibility for these drugs. This is really exciting because previously our customers may have had copays, deductible portions with these types of drugs through the drug plan. And now Medicare is going to be covering that 100% for the patient. So that's really exciting. Now, what do they cover exactly? So they are going to cover the drug itself. So the FDA approved pre-exposure prophylaxis, the drug. They're going to pay for the administration of the injectable drug. So there's two types of drugs, which we're going to get to in just a second as well, but they cover the administration of the injectable portion. The administration, just kidding, we just went over that. Supplying and dispensing the drug. So this would be basically your dispensing fee for the medication, individual counseling, HIV screenings, and hepatitis B virus screenings. Now, they do cover all these things through the Part B plan. However, there are specific items that are covered at the pharmacy level and some items that are not covered at the pharmacy level. So we're going to get into that as well here. All right, can pharmacists furnish PrEP-related services? So this is kind of what I was talking about. Currently under Medicare Part B, pharmacists are not eligible for direct payment for services furnished under the Medicare Part B plan. And so if a pharmacist under stethoscope practice laws furnishes counseling, injects the PrEP drug, or orders the PrEP medication, so that means you're acting as the prescribing physician, those services cannot be paid directly to the pharmacist, and the drugs cannot be paid by Medicare Part B. So what is covered at the pharmacy level? Let's see here. Well, that's not going to be on the next slide. So anyway, basically what's going to be covered at the pharmacy level at this time is the drug portion. So the oral or the injectable medication itself and the dispensing fee of that drug. So we're going to get a little bit deeper into the dispensing fee portions and the drug codes and things like that in the coming slides. But right now, one of the hot topics is what are the modifiers for these drugs? As we know, for medical billing, modifiers are one of the really important factors when it comes to submitting a claim to the medical benefit. These usually give a little bit more detail into what the claim is for, who it's for, kind of goes a little bit deeper than a diagnosis code as to the situation of the patient. For example, if you're billing diabetic supplies, you have to differentiate if your patient is on insulin or not. And so, KS or KX would determine that information, and that is not something that the payer may not already know. So, however, for these type of drugs, Medicare, CMS is not requiring any modifiers at this time on claims related to the PrEP medications. Claims will be processed through the DMAC or the AB MAC without any modifiers. The presence of a modifier should not in itself result in a claim rejection, however. So we're going to get to this when we start talking about the 340B submissions. Those 340B submissions will require a modifier to indicate that it's a 340B patient, and that will not cause the claim to deny for any reason if there's a modifier in place. So it doesn't require a modifier specifically, but if you add a modifier, such as the 340B modifier, the claim will not deny for that reason. All right. Medical billing best practices. How do I bill for these items? So when billing for the PrEP medications, you will need to send 2 claims. If you walk away with any information today, write this down. You need 2 separate claims. And I'll kind of get into the reason why here in a second. The first claim is going to be your drug claim, and the second claim is going to be your dispensing fee claim. So if you're used to medical billing, if you're used to our product in particular, our immunizations specifically, we do add those dispensing fees for you. However, with the way Medicare has these set up, there isn't a way for us to determine which one you want to utilize. So we don't automatically do that. So there will need to be 2 separate claims. And just a tip to process these, you want to ensure that both claims are submitted with the same details. So same date of service, same diagnosis code, same place of service, and bill the claims back to back or at the same time. The reason for that is so that they are attached on our side. We will attach those to be sent out together. And that way you get paid for both portions. If you were to bill them separately, say maybe you forget to bill the administration fee yesterday and you want to go in there today and do it, it's not going to be submitted together, and Medicare could deny that dispensing fee later on. All right, so here is a little bit of a breakdown to talk about those dispensing fees and those drug codings that are available right now. As for the dispensing fee, it's broken down by the oral drug and the injectable drug. So the oral drug will allow you to bill a dispensing fee for the 30, 60, and 90-day supplies of that drug. And the injectable will only allow you to bill the 30 and 60-day dispensing fee. They do not allow a 90-day supply of the injectable, so they're not going to pay that dispensing fee either. I also have included some of the HCPCS codes down below. I'm not going to get super detailed about these codes right now because I want to have time for questions and back and forth with you guys. But all this information will be available to you after the fact as well. So we do have it broken down here by the oral PrEP drug codes and then the injectable drug codes as well. Carter, are we seeing any questions coming through so far?
We got a couple that have been coming through. I answered one. I'm about to answer another one. There's one question we could probably answer very briefly. Okay. I see that the question was asked, is the place of service 01 for the pharmacy? That
is a great question. So as of right now, I would imagine the place of service would be 12 for home, since the patient's going to take that medication home with them. For the injectable portion, I probably have to dig a little bit deeper. They haven't really said specifically what the place of service should be. So definitely if I find that out, I will post that at the end in the response email. We can also have that question in the follow-up meeting on is it the 4th, Carter, or the 8th, 4th?
December 4th.
In our follow-up session. Yeah. So I will get that information. I will supply that in our follow-up session, and we'll try and get that out to you guys as well. But great question. Yeah.
Yeah. And we keep monitoring the Medicare website and all the .gov resources. Right. So as things continue to become available, obviously things will ebb and flow, and we'll continue to update our resources and information to best reflect the most recent information from those sources. One more quick question, Angel, and then we'll move on. Sure. Who pays for PrEP claims for Advantage plans?
That is a great question, and I'm actually going to answer that in a few slides. Awesome question. I am going to get to that. All right, let's look at diagnosis. Little segue, yeah, it's coming up. Yeah. All right, so diagnosis codes. Medicare is specific when it comes to diagnosis codes for this item. They're not always super specific, but for things like inhalation drugs, nebulizers, immunosuppressives, anti-cancers, and PrEP, they are specific. So they want they have a list of diagnosis codes out there. I have included that here in the slide. I'm not going to read through every single one. We're not going to understand what they are unless we really dig into it. But these are the acceptable diagnosis codes as of now. Be sure to follow up with your local coverage determinations to kind of keep up with that information. Like Carter said, we're constantly on the hunt for new information being let out, and Medicare likes to change things up on us like overnight sometimes when it comes to these newer items being put out there. So definitely take this for what it's worth. It could change in the future. So for now, these are the acceptable diagnosis codes that will need to be, one of these at least will need to be on the claim to get payment. All right, here we go. How should a pharmacy bill Medicare Advantage? So Medicare Advantage plans must follow the national coverage determination, including providing PrEP drugs for HIV at no cost sharing at in-network providers. So very, very important here, in-network providers. So what you want to do before you start billing Advantage plans, contact those plans. Make sure you're in their network, right? If you're not in their network, you could be paid less. The patient could have a cost share, which we don't want for our patients, right? We don't want to be paid less either. So we want to make sure that we're following those rules when it comes to the Advantage plans, making sure we are in network. If we're not, we may want to, not that we want our customers to go somewhere else, but we want to do good by the customer, and we also want to make money ourselves. We want to make sure that it's worth us billing. So do your research, contact those payers prior to billing, make sure you're in their network, make sure everything is billable and payable for your pharmacy. Payment for PrEP drugs and services under the National Coverage Determination for a Medicare enrollee should be billed to the enrollee's Medicare Advantage plan, not old-fashioned fee-for-service Medicare. So even though they have a red, white, and blue card, you always want to double check and make sure they're not an Advantage member, because if that goes through for any reason, it's going to deny later on. And we are waiting, 2, 3, 4 weeks sometimes before we get that adjudication information back. And we want to make sure that we're billing it to the right place up front. Links to more information and all the links and resources I've used for all of this information will be listed at the end of the webinar and will be included in the follow-up email as well, guys. What date of service should be used? So for anything related to Medicare, rule of thumb, the day that you provide the service, the day you bill for the item, should be the day you dispense the item to the patient. So this is really, really important when it comes to your audits. Now, Medicare might not catch it right away because they don't know when the patient picked up the item. But if you are ever to be audited, Medicare specifically requires the date of service to match the day that the signature or the day the patient comes and signs for the item and picks the item up. So we get into a pickle sometimes when our patients call, or maybe they do the online, refill option. We fill it and they don't come to pick it up that day. Where we go about our business, we're busy. We don't remember to reverse the claim. And so my rule of thumb when I worked in the pharmacy is you don't bill the claim until you see the whites of their eyes in the pharmacy. Now, is that reasonable for everyone? No. Can we keep track of that in the refill queue when we're just going through and automatically refilling? No, we're not going to keep track of that probably. So our system does have a great way to kind of watch over that and kind of provide a little bit of a cushion before the claim is actually sent to the payer. It's called a hold edit. We allow you guys to choose how many days you want to hold those claims before they're actually sent out to the payer. That will allow you to reverse the claim within that time window before it's actually sent out to make those adjustments, reversals, changes, whatever the case may be. So really, really good information to have, but also our system does work with you to kind of make that a little bit easier. Any questions so far, Carter? Follow up for the last slide. You're on mute.
Rookie mistake. We have a couple, and we'll maybe answer one or two of these and continue on, and I'll continue to answer them in the chat as well.
Okay.
Is there a special contract for the Medicare Advantage plans for PrEP, or can we bill them as long as we are contracted with them?
So when it comes to contracting, it can be very confusing for pharmacy versus a medical biller. So just because you're contracted with them to submit pharmacy claims does not necessarily mean you're contracted with them to bill the medical benefit. So as long as you're contracted for the medical benefit side, you do not have to have any additional contracting or anything like that when it comes to the PrEP medication. It would just fall under the same contract as your medical billing. But that's a great question. I do like to separate those two, though, the pharmacy contract versus the medical contract, because some pharmacies kind of think, oh, well, if I can do one, I can do the other. And that's not the case. So just make sure that you're contracted as a provider, not a pharmacy or a pharmacist. So as long as that's the case, then you should be okay.
Perfect. Thank you, Angel. Let's do one more as we continue through. Let's see. Will a PDP plan reject the PrEP meds if billed?
I'm not sure what PDP plan is.
Okay, I'll flag that.
Yeah, whoever put that in, if you will explain to me what a PDP plan is, I'm happy to try and answer that question. If not, I may have to do some research and follow up on that December 4th date.
Okay, I have one more question I want to quickly ask you, and then we'll move forward and continue. We'll circle back to these. I had a Medicare Advantage patient with a $600 copay due to high deductible, even though we are in network. How do I handle this?
Okay, great question. So you're billing it to the medical benefit, I'm assuming, not the drug portion. And when you say they have a copay, is that copay calculating at your pharmacy level, or is it an actual EOB statement saying, hey, your patient has a copay? That would be my follow-up question. If you can respond to that, we'll follow up with that after.
Yep, I'll keep an eye out for their
Cool.
reply to you. They said, no, I'm billing as a drug portion,
Okay, that would be the reason. The drug
non-medical.
plan, yeah, the drug plan can charge whatever they want at this time. The medical benefit would be where you're getting that no cost share for your patient. So my recommendation would be bill the medical benefit.
Okay, and just for reference, PDP is the prescription drug plan for
Oh,
anyone who is wondering.
perfect.
Yep.
Okay, we will have to come
All
back
right.
to that one question because I
Yep,
don't
you're good. I'll
remember
let
what.
you continue on,
Okay.
Angel. Thank you for stopping and going through some of those.
Yeah. All right, navigating 340B billing and reimbursement. So this has been a really hot topic now that PrEP is being billed through the medical benefit specifically. And we are one of the only clearinghouses that allow these 340B modifiers at this time. So we have a really big advantage and we're really excited for that. So for 340B patients, certain claim types would require specific information to successfully process. These would include modifiers and diagnosis codes. And so for our 340B requirements, our modifier requirements would depend on your pharmacy's qualifications. We cannot tell you or advise you on which modifier to use, but there are two current modifiers for those specific items, and that would be the JG modifier and the TB modifier. Again, that would be up to you to determine which modifier to use. I'm going to go ahead and go to the next slide, and it's going to explain kind of what we would need from your pharmacy in order to get those modifiers set up for you, and how to kind of process through that and what your pharmacy would need to know on their side. So important information for 340B billing. Modifiers must be added by the pharmacy when the claim is processed. So we do not automatically add modifiers for you. Not every patient falls under that 340B regulation, so we don't assume anything. Diagnosis codes need to be collected by the prescriber, of course. We cannot give you that either. Some drugs may require specific diagnosis codes, as we kind of talked about in our diagnosis code slide there. You could find those on the Medicare LCD articles for your jurisdiction, which I believe there is a link to that as well at the end of the conversation here. And I know there's another slide. No, I'm going to go back. Okay, so for the modifiers, basically what we need from your pharmacy, I didn't realize this was omitted from the slide, but we would need a list of your NDCs that you plan on billing that would fall under that 340B requirement, and which modifiers you plan on using. In that case, once we have that information, our system can put that information into the computer, into the system. Our leads, our supervisors, we can put that into the system in what we call a HCPCS payer row, and that will allow you to bill that with the modifier. Now, one thing that we cannot do is make it a requirement. So like I said before, not every patient falls under that 340B rule. And so we can't flag it up front and say, hey, you're missing a modifier. It would be up to your pharmacy to determine which patients or which NDCs fall under those rules and to add that modifier on your side. So make sure, if you have to flag the patient's profile or whatever the case may be, you can, some pharmacy management systems will allow you to flag certain NDCs. So however you guys want to handle that, you would have to know when and where to add that modifier on your side. All right, so discussing med bill, I'm going to go ahead and hand this over to Carter. He's going to kind of give you a little rundown.
Yeah, and before I jump into this slide, again, first off, thank you everyone for all the questions. We have quite a few coming through that I'm marking and saving. As we continue to go through, please feel free to keep asking questions. We will try to get through as many of them as we can. Additionally, I did see one or two questions that came through asking about learning more or seeing the platform or et cetera. And there should be a get demo button at the top of your screen. If at any point you'd like to set yourself up to get a one-on-one personalized scheduled demo of the platform and how this can work for you and help you in your pharmacy, hit that button. That just lets us know that you want us to reach out to you, and we will reach out to you and get you set up and get a meeting scheduled with you and get you taken care of. So I want to quick shout out and highlight that for yourself. But let's talk about MedBill. And MedBill obviously is EnlivenHealth's medical billing solution. We wanted to take a step back for a moment and just talk about it at a high level and how it can really help you in your pharmacy. MedBill and the way we've designed it is to really simplify the complexities of medical billing. as you've heard today with PrEP and everything going on, there is a lot constantly changing, updating, flying around, going on in the medical billing world. And throughout your journey, whether you're new to medical billing, you are maybe a little bit, experienced, or maybe you are very experienced in the medical billing world and realm, there is a lot always going on, and it can be confusing. And so we like to set up our system and processes to be as easy and as simple and as straightforward as possible to help cut back on some of those unknowns or uncertainties. The key for our service and the way we set it up for our pharmacies is that we really want to make sure that we are allowing the pharmacies to optimize all their processes, for services just like Medicare's PrEP coverage and also beyond, right? Our solution makes it very easy to handle these claims, not only just for these specific claims, but for a variety of claims and for a variety of payers, turning your pharmacy ideally into a true patient care hub. By using our solution and by taking the steps and using the processes that we have in place, you can really cut down and really eliminate also a costly manual billing process that you might already have in place. And with the power of what we have stood up for you and for your staff and for your store, it's a great way to keep track of everything. We have detailed analysis, reports, even a dashboard to help you make sure you have everything all in one place that can be very seamless and streamlined for you. One key aspect of this that I really love is that you don't have to download a specific software into your PMS or whatnot. You can bill to our clearinghouse using our BIN and PCN. So no matter what PMS you're on, as long as you can bill through it, which I would imagine you can work with us, and it integrates right into your workflow. And another thing that I'm very proud of and something that I love to highlight is our support team. I'm very proud of the EnlivenHealth support team that we have here, and they have very robust support systems in place. Shout out to Angel. She's kind of a wizard at this, and she's really large part of the success that we have with the support team, because she helps train them, keep them up to date with all this information. So at any point, whether you have MedBill now or you get it in the future, you should really reach out and utilize our support team. They're always being trained on the most up-to-date information. As new PrEP stuff comes out, or as we hear new things in the market, or with changes here and there, we want to be up to date for you, and we want to be a good source of truth and there to help you. So whether you have questions today that you're putting into the webinar chat, or in the future that you want to get help with, we are here for you and want to help you as much as possible. And lastly, I mentioned it before, I'm going to mention one more time. If you are interested in seeing MedBill in action and how this can really integrate into your pharmacy and help you and your staff, and help not only them, but your patient population as well. And we have an info session scheduled as well for December 4th at 1 o'clock Eastern time. You see it on your screen right there. There's a little banner actually scrolling across the bottom of your screen right now where you can click that and sign up for that. That will be a group session, much like we're doing right now, where you can see the platform. It is a no pressure demo where basically we're going to walk through some of the ins and outs, and you can just sit in and ask questions just like here today. But again, if you want that more personalized one-on-one Q&A option where you can go through with a representative from EnlivenHealth, we can sit down with you individually. We would also do that as well. So 2 options for you if you want to get more information about not only PrEP, but also the MedBill solution as a whole. And lastly, I think we have a lot of questions in the chat in the Q&A.
Let's get to it.
So I would say, Angel, unless you have anything else, we can go on with the PowerPoint and maybe hopefully answer some of these questions we have here.
Yeah, let's get to the questions.
All right, let me go to our placeholder slide here and let me filter these. I have quite a few pinned here for us. All right, you ready, Angel? I'm going to rapid fire these for you.
Let's go.
Okay. Is there a reimbursement difference with 340B PrEP billing versus non-340B PrEP billing? And how much?
That's a great question. I was just talking about this earlier. I believe how that works is you get a discounted rate on your drug up front. I'm not sure of the reimbursement differences, but they do require you to note that it is a 340B claim. I will write that down. I will take that back for the next session. I'm not sure if the reimbursement is different, but I do know that there is a discounted rate up front, if I'm not mistaken. But let me take that back, and I will answer that in our next session here. All right. So.
Thank you, Angel. I'll give you a second
Mhm.
while you write that down.
I was really
Um,
hoping that wouldn't get brought up, but I'll research
yeah.
that.
And again, I mean, there will continue to be different resources that come out. We've been monitoring a couple of different spots where they've been publishing stuff. So as soon as we
Right.
hear stuff, we turn around and relay it out to our customers and to our teams so everyone's on the same page. All right, let me go back to prioritized. Okay, another one for you, Angel. Can the bill be split? Meaning pharmacy bills for drug portion, physician bills for administration.
So the administration. So when you say administration, are we talking the administration of the drug itself? So they give they physically give the shot to the patient, or are you talking administration like a dispensing fee? I'm guessing it's the first. If that's the case, then yes, the physician should be able to bill the administration portion without actually billing the drug portion, but the pharmacy will not be able to bill for that administration portion.
Okay, beautiful. And if you are the person that asked that question, if you want to clarify, you're welcome to, and I'll keep an eye out for that. Here's a question that hopefully should be a little bit easier. And this one is one we get all the time, but Angel, I'll let you take it. Does EnlivenHealth help us with credentialing as medical providers with the insurance companies?
So we do have a plan that will assist you with Medicare clinical services and CLIA waivers, which are not required for this type of item. But we do have a credentialing service for Medicare Part B, for the DMEPOS payer, and for the clinical payer. We can help you get that set up. But for commercial payers, we can provide contact information. We just wouldn't be able to assist you with the actual contract and getting set up with those commercial plans. Mostly because they don't allow third parties to do that. It has to be, just pharmacy, between pharmacy and the payer. So yes for Medicare, no for commercial plans.
Awesome. Thank you, Angel. Another one, I can take this one. Love this question. How do I sign up for medical billing? Great question. You can hit that get demo button right there. That will let us know that you are interested and eager, and that will kind of be an indicator to us, and we will reach out to you and get you taken care of. Another question we have here, how do we become contracted with all the plans as a provider?
That would be payer by payer. You'd have to go to each individual payer. You want to contact the provider enrollment center, not the pharmacy enrollment center, provider enrollment center, whether that be through their portal or on the phone. And they would be able to walk you through that process. Unfortunately, it's not like a one and done. It's every payer has their own process. And so you'd want to make sure that you're just hitting up each of those payers.
Yep, completely agree. Here's an interesting question. I know EnlivenHealth helps pharmacy medical benefit billing. Do you help doctors' office billing too?
We currently, I don't know if we have any doctor's offices right now. We do have podiatrist offices that we work with. So I would imagine, yes, it's possible. But I think the way that doctor's offices go through and bill is a little bit different than billing from the pharmacy, but I'd have to do a little bit of research on that. I don't think it would be impossible for us to work with a doctor's office.
Yeah.
But right now we our main focus is pharmacy. But we do have some podiatry offices, so I know it's possible.
Yeah, and whether you're a doctor watching this right now, a podiatrist, or probably the majority is pharmacist, not everyone knows this. So I like calling this out sometimes. This is a great kind of segue into this. Is you can actually bill directly through the MedBill portal. So if you want to specifically log on to the portal, it's just a website, and sign on. Not only can you go in there to track your claims and do some different reporting and measurements and whatnot, but you can actually bill a claim directly through the portal itself. And sometimes people really like doing that and take advantage of that. A lot of times people will just bill straight through their PMS, but still wanted to highlight that and call that out for anyone that did not know that and maybe wanted to take advantage of that feature.
Yeah, absolutely. So when you're not a pharmacy, you don't have a pharmacy management system to bill claims through or to utilize a BIN and PCN number. So yeah, exactly what Carter said. We do have the capability of billing directly from the platform, which I think would be the route you would go if you were a doctor's office wanting to get into the MedBill solution.
Absolutely. I actually had quite a few questions about this. I can answer this really briefly. A lot of questions about, will these slides be available? Will this webinar be available, or the recording? A lot of questions about that. The recording for this webinar will be available after it has been completed. We're going to go ahead and once it's wrapped up, I think they polish up and everything on the back end, but at some point after the webinar has completed, this should be available for you. And if you specifically don't see it, reach out to us and let us know, and we can get you taken care of for that. Another question for you, Angel. I'm trying to think, how do you do this for in-clinic administration of injectable PrEP? I think that was referring to another question that he had put in.
So are you a doctor specifically, or are you a pharmacist? That would be my question.
I'll look at their other questions. I'm going to ask you another one. I'll look at those questions. Here's a great question.
Okay.
How do we know if the patient has an Advantage plan?
That is a good question. So my recommendation, and I cannot preface this enough, go onto Medicare's website, whatever your jurisdiction is, Noridian or CGS, go pull eligibility directly from their website. It's going to tell you who their Advantage plan is. It's probably going to give you a contact phone number as well. I don't believe it gives you an ID number, so you'd have to reach out to your patient for that. But Medicare's website and our website, actually, we have an eligibility feature in our system. It will also tell you if they have an Advantage plan in place of traditional Medicare. Great call out. We do have that capability in our system. Medicare's website may give you a little bit more information, but our website is definitely going to say, hey, this patient has Aetna as their primary. Yeah,
great question. I'm glad that was asked. To circle back to that last question, Angel, that I had asked, that he actually had replied back, and he said it was in reference to the service date. So the question again in reference to the service date is, how do you do this for in-clinic administration of injectable PrEP for the service date?
So I still would have the question, are you a pharmacist or are you a doctor? Because you will not be paid for the injected portion. You will not be paid for the administration of the drug itself as a pharmacy.
So it sounds like, again, they replied, said how a pharmacy correctly bill a Medicare prescription for a service date if they are delivering the injectable to a clinic for administration.
Okay, then your date of service will be the day you deliver it to the doctor's office. That helped tremendously. Thank you. Yeah. So if you are delivering an item, if you are delivering the pill, the injectable, whatever the case may be, your date of service will be your delivery date, the day you mail it out or the day you send it to the office. Yeah. Great call out. Thank you.
Perfect. Yeah. Glad we can get that answered.
Yeah. I was like, I need more.
Yeah. I'm trying to piece it together because it doesn't group all the one person's stuff. So I'm like trying to fish through it really quick. Here's another great question. You mentioned that the drug claim and the supply/dispensing fee claim should be billed back to back to prevent denial of part of the claim. So to clarify, if a pharmacy is billing the drug claim and the drug is being administered by the doctor, are there concerns with the pharmacy receiving payment for the drug claim? And I have a little more information if you want me to add that in too.
Well, go ahead. Yeah.
They put in parentheses, so the doctor is billing the administration fee. So just to clarify that.
Yeah. Okay. So there is a difference between the administration fee and the dispensing fee. So what you're going to be billing is the drug and the dispensing fee of the drug. So that means that you are giving the drug to the patient or to the facility to administer. The administration would be they are physically putting the drug into the patient's body. So those are two different claims we're talking about. You are going to bill the drug and the dispensing fee at the pharmacy at the same time. The doctor will bill the administration fee. It's very confusing because we use those words interchangeably, but they are two separate fees. And so for the pharmacy side, you're billing the dispensing fee. And actually, I'll go back to our slide here. And just so you can kind of, I'm a visual learner, so we can kind of look at what that looks like. Sorry, guys, it's making me go click. I don't know how to do it just by, I think it was my first slide. Yeah, so the administration, so that would be giving the injectable to the patient, putting the drug into their body. The supplying or dispensing fee, that regardless of the route, so injectable or oral, that is what you're going to be billing for, is that supply dispensing fee and the FDA approved drug. The doctor would be billing this administration fee. And I don't know if you can see my mouse, I'm probably just making this up, but the administration fee is that second bullet point. The supply and dispensing fee is that third bullet point, and then the drug is that first bullet point. And then here's kind of, let's go back to this. So the dispensing fee would be this Q code, depending on if it's oral or if it's injectable. So, and then also just depending on if it's a 30, 60, or 90-day supply, there's 3 separate codes for each one. You would bill that code and the drug below it, if that makes sense. So on the left-hand side, we've got the oral PrEP administration, or I'm sorry, this is probably my fault. You guys are confused. We have the oral dispensing fee and the oral drug. And on the right side, we have the injectable dispensing fee and drug.
And another great call out I like to make, and I know I've already said it before, but if you are using our service and say it's been a couple days since this webinar and you've slept since then and you've probably dispensed a ton of prescriptions and you've forgotten some of this information and you're trying to bill this and you get lost or you get confused or you just have a general question, you can still reach out to our support team and we're still happy to help you. So if you have our MedBill service today and after this webinar, you're going on your way and you start, getting ready to bill these, maybe, beginning of next year when you start running these processes and billing for these, you hit a snag or you have some more questions that come up or you've forgotten a little bit of this, reach out to us. Our support team is here to help you every step of the way, and we'll be happy to help you with anything you might be encountering.
There's also a resource for this in your resources page. So it has all of this information. Yes. Yeah, utilize our resources. When you log into the MedBill platform, it's the very bottom tab on the left-hand side. It's resources. You're going to open that up. You're going to go to billing guidance, I think it's what it's called, and it is listed under the PrEP. So great information. Yep. It's downloadable, printable. You can take it, do what you want with it. But it has all of these codes in there. All of the information that we've talked about today is also in there. So really, really great feature of our platform.
Yep. I think I have about 5, hopefully, rapid fire questions we can go through real quick if you're ready, Angel.
Okay. Yep.
All right. First one, does your pharmacy have the ability to interface with the pharmacy software? I could answer that, but I'll let you take it.
Yes, BIN and PCN. We basically give you a BIN number that gets your claim to us. And then the PCN would kind of differentiate by payer. So the PCN is depending on the payer and the payer ID that you're wanting to bill to, that would be different for each payer. And that's going to get your claim to us. So you do not have to download any additional software, hardware, any of that. It's through a BIN and PCN, just like you would a normal pharmacy claim.
Yeah. If you have specific questions about the way it works, let us know. I want to make sure that we answer specific, questions surrounding that. If there's anything you want to make sure it does or doesn't do. So if there's anything else surrounding it, let us know. We'll keep moving on.
Yeah. Really quick. As long as your pharmacy management system can submit a D.0 file, we can work with their system.
Correct. Great call out.
Yeah.
This one should be an easy, quick one. Can we use your platform for billing DME items like wheelchairs, et cetera? And do you provide audit support?
We do not provide audit support, but we do have the capability of billing from the platform, any item. We also can help you work with your PMS vendor to submit those claims from your pharmacy management system. Instead of having to go to a separate portal to bill those out, we can work with your PMS vendor to create basically a fake drug that would be a DME item that wouldn't necessarily have an NDC, such as like MTM services, things like that, like time that you don't have an NDC for. It's not a physical item. We can set up those things as a fake drug with your vendor and allow you to submit those claims through your pharmacy management system as well. But yes, you can utilize our system for any item that you want to bill. It's basically you just set the item up, set the patient profile up, and bill it like you would on your system. But no, we do not support audits. We can kind of help you understand it maybe, but we don't assist in audits.
Thank you, Angel. Another one really quick is how much should the dispensing fee be? What is the max? Great question. I'll let you take it, Angel.
Yeah, that's a great question. So I believe there is a link that is going to be sent out. It's at the end of the web, or it's at the end here. I believe it's going to be sent out at the follow-up email. It has links and resources so you can find that information. I don't know off the top of my head, but you want to make sure that you know what it is so that you're submitting that price correctly in order to maximize that reimbursement. Because if you submit less than the maximum allowable, you're going to get paid less than. So really good call out. Definitely make sure you're doing that research and figuring out what those fees are so that you're submitting the price either at or above that cost so that you're getting that maximum allowed amount.
Absolutely. All right. Not a couple, we have a whole bunch more. We'll try to keep getting through these. Let's see. Really quick answer I can do. I got in late. Would I be able to get into the webinar or rewatch this one? Yes, you'll be able to rewatch this one after the webinar is completed and the recording is available. Question for you, Angel. Our pharmacy is already set up to charge Part B. Do we still need your medical billing services?
Yeah, that's a great question. You are not automatically set up to bill Part B. You would have to be registered or contracted or whatever the provider enrollment center requires per that payer. Especially when it comes to Medicare, they do have policy. You do have to be registered as a medical provider to bill Part B. So that would be a DemiPost PTAN or a clinical PTAN. At the moment, I think they're paying this drug under both of those. My recommendation would probably be the DemiPost just because there's more things you can utilize with that PTAN. And then what was the second part of that question?
Oh, I just scrolled out of it.
Sorry, guys.
Oh, let me go back to the.
So you're not
unanswered one.
automatically, no, but I feel like there was a second part that I'm missing.
Do I need to work with y'all? It was.
Oh,
Yeah. Do I need you?
do you have to have us? So you do have to have a clearinghouse. Basically what our job is we collect the D.0 file from you. So basically it's the plain English version that comes from the pharmacy. We're going to make that nice and pretty. We're going to check all the boxes, make sure everything is there on the claim. We're going to turn it into what's called an 837 file, which is basically Japanese or something that nobody understands. And we're going to send that information to the payer. So do you have to use us? Not necessarily, but you do have to have a clearinghouse as a pharmacy in order to bill the medical benefit.
Great highlight. You stole the way I described it. I'll allow it.
I did.
So this is a good question to clarify. I'm actually glad someone asked this. Is the bin and PCN that you referenced, Angel, earlier that they bill to for us as the clearinghouse, is that bin and PCN the same as the Medicare bin and PCN, or is it different?
So Medicare does not have a bin and PCN.
Yeah, maybe they're referring to the PrEP bin and PCN. But the question is the bin and PCN the same as the Medicare bin and PCN, or is it different?
So if you're already billing, I'm going to assume this is the route that you're talking about. If you're already billing Medicare, basically it would be 007895 is the bin number and 001 as the PCN number. And you can say yes or no if you'd like in the thing, and maybe Carter will catch that. It will be the same, yes. But if you're talking about a bin and PCN to a drug plan, no, it is not the same.
Yeah, I'll keep that one flagged. This is another great question that I love that someone asked. How soon will we know that a claim will be paid for sure? They are concerned about the claim being denied after it has been dispensed. Love that question.
I love that. I love that question because it's a great segue to our reconciliation and getting your EOBs to us. So our system does so much work for you. It's still a manual labor. It's still something you have to pay attention to, but we do have the capability of receiving your 835 files or your EOBs, and our system automatically updates the status of your claim when that comes in. So if it's denied, usually turnaround time is a week to 2 weeks, and it'll flag it right away and say, hey, this is denied. Sometimes it's a couple of days with Medicare, it just depends on the payer. But usually it's a shorter time to figure out if it's denied rather than paid. For the paid portion, it takes about 3 to 4 weeks, again, depending on the payer and depending on like how many claims are coming through at a time. You know, during flu shot season, it can be a little bit lax there, but 3 to 4 weeks is usually about the time you'll see a payment come through. So it really just depends, but really good question. We have a really simple process to get those EOBs to us, which we can get into in our next demo, but take advantage of that, get your EOBs all in one place, allow our system to work at its best and help you organize that information, help you keep track of that information, and help those statuses be updated automatically as it gets submitted.
Awesome. And I saw someone mention that they couldn't hear some of the questions I was asking, so I just turned my volume up a little bit. So hopefully that helped. Another question for you though, Angel. Is there a way to get an estimate of what medical billing will reimburse as opposed to pharmacy billing?
Absolutely. Yeah. So Medicare does have a fee schedule. You can actually, let's write this down, guys, backstage fellas, let's write this down for our next demo where I can walk you through kind of where to find that on Medicare's website. That would be a really, really cool thing for you guys to see, just because not everybody knows how to use it. So in our next demo, I will plan on showing you guys kind of what that looks like and how to find it. And that won't just be for PrEP, that'll be for any drug. But yeah, see us on our next info session. I'll make a point to kind of show you what that looks like and walk you through that. But yes, you can get those fee schedules ahead of time. And actually,
great resource.
Yeah, our system has those fee schedules loaded for Medicare only, not for commercial payers. For Medicare, we have those fee schedules loaded. So we'll tell you right away, hey, you're billing, here's the fee schedule, here's what they're going to allow. And so that way you can make adjustments to your submitted price if you need to.
Great answer. And also a great question. Another one just came through. If it takes 2 weeks to deny a claim, how do I ensure the date of dispensing then matches delivery of medication to the patients? It could be denied after sending it to the doctor's office.
So the doctor's dates of service do not have to match yours. If that's the question, it does not have to match. Only your two claims have to match each other for our systems to submit them together. So does that help? Yeah, it doesn't, like, those dates of service don't have to match yours. It's not going to affect your claim at all.
They're saying that that's not particularly what they're asking. If you can maybe rephrase that question a little bit for us, we'll answer a couple more and I'll keep an eye out for your name to answer it. If you don't mind just typing that back in. Question for you, another one, Angel. Is there a different contract for Part B injection than oral or from the oral billing?
No, not at this time.
All the same.
Yep.
Awesome.
Now, again, that's just the dispensing of the drug, not administering it.
How is the JG and TB modifier different?
That is a great question. They're not super different. And actually, Medicare is planning on discontinuing one of them. I can't tell you which one. I'm not totally sure. So eventually, I think there's only going to be one. But you'd have to kind of get in touch with your jurisdiction just to kind of, I have the definitions of them, but they're really not super specific. So like, basically so the JG is the drug or biological acquired with 340B drug pricing discount reported for informational purposes. And the TB, drug or biological acquired with 340B drug pricing discount reported for informational purposes for select entities. I don't know what those select entities are, so that would have to be researched. Okay. And that would be something that your pharmacy would need to look into to figure out which one your pharmacy qualifies for.
So you just mentioned something that'd be a great segue. Someone had just asked on 340 claims, how do we find what quote unquote selected entities are? Yeah,
I would say Medicare LCD or CMS.gov. They have a great search engine. You can search that there as well.
Okay.
I imagine if you're set up with 340B, whoever does that setup would be able to kind of differentiate that for you, but I'm not totally sure.
Okay. We had that question come back through from the gentleman. I'll read it out to you, Angel. If it takes up to 2 weeks to confirm denial, then you cannot dispense the PrEP until you can confirm it will not be denied. Therefore,
I see.
Before delivery to the MD office, you have to bill 2 weeks before patient receives the drug.
So that is a risk that your pharmacy signs up for when becoming a provider to bill the medical benefit. It's basically like if you go into the doctor's office, they're going to give you that service. They're going to, check your temperature. They're going to do all the things. They don't know if they're going to get paid or not, but they're going to do that because that's what they signed up for. So as a pharmacy becoming a billing provider or a provider to the medical benefit, that is just a risk that you sign up for, unfortunately. So it would have to be, which is also kind of why Medicare puts that caveat in there, is so, when you sign up to be a Medicare provider, they expect you to provide that service and to basically give that item up and work through those denials later if that happens to be the case. It's unfortunate. I don't make the rules, so don't shoot the messenger, but it's just kind of a risk that you sign up for when becoming a medical provider.
Yep. It's a good call out. A lot of questions about 340B webs. Looks like there's some people asking for a 340B webinar now. We'll keep that.
Yeah, that's really more, I don't know that that's something that we could really help with too much, because it has to do with more of the drug side of things, and not necessarily like the billing side of things. But basically why I brought it up in our meeting, in our session, is because we do have the capability of adding those modifiers for you where no other clearinghouse is offering that right now. So that's the reason I brought it up. We don't have a lot of information because it's more geared towards the drug, and like normally that's a pharmacy thing, but this has been a hot topic lately in our meeting, in our sessions with customers, and they just wanted to make sure that we could add those modifiers, and we can. So I'll do some research, and I'll try my best, but I can't promise that that will be something that we can provide.
Yep. One or two final questions here as we start to wrap up. Again, few minutes left. If you have any additional questions or anything else you'd like us to answer or cover really quick with the last few moments, let us know. But again, appreciate everyone being here. Angel, question for you. What is the point of a pharmacy billing Medicare rather than Part D?
Well, right now is if the patient has Medicare, I believe it will no longer be covered under Part D. So that's one benefit. Another benefit, there's no DIR fees. There's no cost share to your patient, which is a huge benefit for our patients. Those would be my three.
Thank you.
For commercial payers, it's up to you. For commercial plans, I can't say yes or no. I can't tell you that there's a benefit over the drug plan, but those DIR fees are hitting hard this year, and next year's not going to be any better. So that is the major benefit here.
Yep. Getting a lot of questions here towards the end about demos and wanting to know kind of sign up process, what that looks like. Again, hit the get demo button. Really briefly, kind of just to call it out for you guys. We have a dedicated team that will work specifically with you to get y'all set up. We have an entire onboarding team, entire support team, a lot of wonderful people that we have trained and have been here for quite a while that are just top-notch folks that we're very blessed to have here on our team, and really excited to work with you guys. So if you have any questions about getting signed up, hit that get demo button, let us know. We'll make sure to get you taken care of.
Yeah, and if there's any questions that we haven't answered, we can do that in our next demo session on the 4th. So we'll take note of all those questions and just make sure everything's covered.
Absolutely. I think that's all the big ticket items. Again, we'll leave it open just a couple more seconds, but as we start to get towards the final moments here, I know I said it before, but I'll say it one more time. I know everyone in your pharmacies right now, wherever you may be, you do not have a ton of time. So carving out an hour of your day to spend with us, we really appreciate it and very thankful for your time today. Again, if you're looking for the recording of the webinar or the information today, hold on to that. We will be posting it at some point. We'll let you know. If you cannot find it, reach out to us. Let us know. We'll help you get a hold of that. And then lastly, would love to see you on that December 4th info session. The banner scrolling right now on the bottom of your screen. So click that info session link, sign up for that. Angel will be hosting that. We'll be there to answer more questions on that and give you an in-depth guide. And lastly, the get demo button. I see Nikki on the screen, probably about to give me the cane and pull me off. So we'll go ahead and wrap with that. Angel, any last things you wanted to say from your point of view over there?
I think I'm good. Yeah, definitely see us on December 4th. We're going to go through the platform. We're going to explain how that works. It's specifically with PrEP, but also just to kind of give you a visual of what it looks like, how it works for your pharmacy, all its functionalities, things like that. So hit us up there. But then with those demos too, our sales department is really good. They bring people from our support team to assist them. So really good information there as well. Yeah, that's all I have.
Awesome. Well, thank you very much, Angel, for your time, and thank you everybody else for joining us today.
Yes,
Until
thank you
December
guys.
4th, we will see y'all next time. If you need anything at all from here at us EnlivenHealth, don't hesitate to reach out. Thank you so
Thanks,
much. Y'all have a
guys.
great rest of your day.